Welcome back, anatomy students. Today we're going to talk about articulations. We're going to talk about joints. When two bones articulate, they join together. So we have one main objective, and that's just simply to categorize joints. There's two different categories. We can classify joints according to their structure, or we can classify them according to their function. So each of these has three categories. So we want to be able to list examples of each category as it relates to function and each category as it relates to structure. So first of all, just the scientific term there, articulation, means joint. So where two bones are held together. What's the purpose of a joint other than to hold our structure? It's to allow us movement. So the greater the degree of movement within the joint, the more movement our bodies can handle. And every bone in our body has a joint with another bone except for the hyoid bone. The hyoid bone has no joint with any other bone, and it is the only bone that has that. So that's its claim to fame. I tell you that I like to test you on claims to fame, so that's one of them. The hyoid bone sits above your larynx, which is your voice box, and I'm using it right now. The muscles of my tongue are attached to my hyoid bone. So here's our first classification. We can classify joints according to their function. In other words, we classify them according to the degree of movement they provide. It's either none, some, or a lot. So synarthroses, the arthroses are going to be the categories related to function. So syn is not at all. So these are your immovable joints, synarthrotic joints. The most common example that we have are those in our skull. So the sutures are synarthrotic joints. Amphiarthrotic joints, amphi is partial, right? You think of amphibian, it's a part life in water and part life on land. So that prefix amphi is referring to a little of this and a little of that. So it has a little bit of movement. So you have joints within your rib cage, and your ribs can move a little bit, as well as your vertebrae. Your vertebrae move just a little bit in between each other as well. Diarthrotic joints move a lot. So all of those in your appendages are diarthrotic joints. So your elbow, your hip, your shoulder, even in between your fingers are diarthrotic joints. So the arthroses are classifying according to the degree of movement, in other words, according to their function. So now joint classification according to structure has to do with simply what it's made of. So joints are either made of fibrous tissue, cartilaginous tissue, or synovial capsules. So fibrous joints are held together by fibers, and fibers are pretty strong. So it turns out most fibrous joints are also synarthrotic joints. So I can use the same example. Once again, the bones of the skull are fibrous joints. The cartilaginous joints, because of that cartilage is somewhat flexible, they can move a little bit. So again, the cartilaginous joints are also mostly amphiarthrotic joints. So the pubic symphysis, the rib cage, the vertebrae, they all have cartilage adjoining them, and so they have a little bit of flexibility. And finally, the synovial joints. I bet you're recognizing the pattern here. The synovial joints, they have a joint capsule, a cavity, lots of space. Bones can move within spaces, so that makes it so they move a lot, right? So the synovial joints are also typically diarthrotic joints. So in our knee and in our hip and in our wrists and elbows and all of those appendage joints. So the fibrous joint, I'll give you another example. Here is one between the tibia and the fibula. So you can see this strong ligament band. Ligaments hold all bones together, right? So you can see that band. To me, it reminds me of stitching. So it stitches it really tightly. So these fibrous joints, like the sutures, are synarthrotic, which means what? That they can't move, right? So another example, you have syndesmoses and gomphoses, and these terms aren't going to show up on my tests, but I like to give you a little bit of extra information. So syndesmoses, that is the name of this joint between the tibia and fibula. And then gum fosses, that's the ones in your gums, holding your teeth in. So I do want you to know the word synarthrotic, meaning no movement, and I want you to know the term fibrous joint, meaning they're held together by fibers. And I would like you to know some examples, but you don't have to know the term gum fosses or syndesmoses. So this cartilaginous joint, in our most recent lecture, we talked about the pubic symphysis, so that cartilage joint between the os coxa. So that would be an example of a cartilaginous joint. Some are synarthrotic, the majority are amphiarthrotic. You also have those discs in between your vertebrae, so that provides your vertebrae with a little bit of movement as well. So the synovial joints, we have 6 different synovial joints we'll talk about. We're going to talk about the synovial joint structure in a separate mini lecture. For now, we're just going to name these joints, give examples, and describe what type of movement they provide. So I have had this as a free response question before on my test, so you can start planning out your answer. The gliding joint is found in your wrist. The pivot joint, we talked about our atlas pivoting on our axis. The saddle joint is an interesting joint because it's only found in one place, in your thumb or your pollex. The condyloid joint is found in the knuckles of the hand, for example, and the ball and socket joint is one of the ones we're most familiar with, I feel, the shoulder and hip, and then you have the hinge joint as well. So you can see these pictures showing the ball and socket joint, and you can see the hinge joint here, and we'll talk about each one of these separate. So here's the gliding joint, also called the planar joint or plantar joint. So most commonly we talk about this in the wrist and ankles. And when I say in the wrist, I mean between the wrist bones, not between the forearm and the wrist. Okay, so that can be a tricky thing. When I'm talking about gliding, your wrist bones, those 8 wrist bones, carpals, they slide over one another. So that's what you see in this picture here. So this is true in the foot as well, in your ankle bones. The saddle joint, like I said, is only found in the thumb, and it provides up, down, and side-to-side motion. Go ahead, give it a try. See if you can provide any other motions. So the saddle joint is only found between the pollex and the carpals. The condyloid joint, condyloid is found in the wrist, now this time between the wrist and the forearm bones, right? So between that radius and the carpals provides, see here, provides a condyloid joint, which is similar to the saddle in that it allows up, down, and side-to-side motion. Again, give it a try. Can you move your hand any other way? Also here in your knuckles, so not in between each phalange, but here between the metacarpals and the phalanges. So you have the convex end of one fitting into the concave end of another. The hinge joint is another one that we're quite familiar with, I feel. It's in our elbow and on our knee. Notice here it acts like a door hinge, so it allows movement in a single plane. So this allows for flexion, which means the decrease at an angle, and the extension, which is increase at an angle. People misuse the term flexion. They say flex your muscles. You're contracting your muscles. You're flexing the joint when you cause it to become smaller. The pivot joint, we talked about 2 different pivot joints already because we've already named all our bones. So we talked about the rotation of the atlas on top of the axis that allows us to say no. And then also we showed how we can supinate or palmate our hand. Turning it upwards is a supination, and that happens because the radius pivots around the ulna. The ulna stays stable. The ball and socket joint is another joint that we're pretty familiar with. We talked about this one in an earlier lecture when we talked about the articular surface of the epiphyses. So we talked about the head of the femur or the head of the humerus. We talked about the acetabulum of the pelvis or the glenoid fossa of the scapula. So you have a ball-shaped head fitting into a cup type of socket. And so that creates the ball and socket joint, which allows the greatest degree of movement because you can move it all around in a circle. So that's all I have. Short and sweet, we named 3 different classifications according to function: diarthroses, synarthroses, and amphiarthroses. You should be able to describe those and match those with examples. We also named 3 different structural classifications. We talked about fibrous, cartilaginous, and synovial. And again, you should be able to describe each of those categories as well as match it to common examples, and maybe even in a free response talk about the 6 different synovial joints. So that's all I have for you today. Thanks for listening.